everyone, my name is Mary Balid, and I will be presenting on the case for intergenerational interaction for elder social isolation. So a little bit about me is that I am a current senior from Queens, New York, and I currently attend the Mary Lewis Academy, which is also located in Queens, New York. I have an identical twin, and she's pictured right next to me to the left. I love to sing, and I also love to play badminton. I currently play second doubles on my school's varsity badminton team. Outside of school, I'm very passionate about geriatric care and interaction, and I'm junior leader at Derote's Next Generation Teen Council, which is a nonprofit organization that aims to alleviate senior social isolation, which is actually what this presentation is about. In the future, I intend on majoring in public health, and I also intend to pursue research related to ageism and health disparities. So first, I would like to tell a story. These are my grandparents. This is my Lolo and my Lola. Before the COVID-19 pandemic, they were very active individuals in their community. They would talk to their neighbors all the time, walk around the neighborhood, get something to eat every now and then. Because of the COVID-19 pandemic, however, their actions became very, very limited. While my parents were able to interact with other people because of their professions, and I was able to interact with other people because of schooling on Google Meet, my grandparents were unable to interact with anyone for the duration of the entire COVID-19 pandemic. Unfortunately, this scenario does not apply only to them. Instead, it applies to a wide range of older adults in America. In fact, COVID-19 exacerbated already existing elder social isolation to the point where now more than ever before, older adults are living in social isolation. But what exactly is social isolation? The National Institute of Health defines social isolation as the lack of social contacts and having few people to interact with regularly. However, there is another definition that I would like you all to know, and that is epidemic. Currently, the United States is experiencing a social isolation and loneliness epidemic. And this can be seen because approximately half of United States adults report experiencing social isolation and/or loneliness. In fact, some effects of social isolation include a 29% increased risk of heart disease, a 32% increased risk of stroke, and for older adults, a 50% increased risk of developing dementia, and an increased risk of premature death by more than 60%. And so if half of adults in this country are experiencing social isolation and loneliness, it puts them at a greater risk for having these diseases. It is important to note, however, that though social isolation can affect any individual in the United States, older adults are disproportionately affected and are affected more than any other age demographic in the United States. In fact, one statistic reports that 1 in 4 adults 65 and older are considered to be socially isolated. We can see that in this graph that I've edited from the Commonwealth Fund, that high-need isolated older adults are 3 times more likely than their not isolated high-need counterparts to have a depression or anxiety diagnosis. And we can also see that high-need isolated older adults are more than 2 times more likely to be emotionally distressed than their high-need not isolated counterparts. And so clearly there are physical effects of social isolation, but there are also mental effects to well-being that are present. And for older adults in particular, isolation can lead to a disturbing trend in numbers in mental health. So is there a solution? What can be done to address this growing social isolation and loneliness epidemic? Well, fortunately, there is a solution, one that is simple and one that anyone here at the Global Health Leaders Conference can initiate, and that is interaction. Today in particular, I'll be speaking about one kind of interaction known as intergenerational interaction, which aims to bring people together in purposeful, mutually beneficial activities which promote greater understanding and respect between generations. Intergenerational interaction is usually brought about through intergenerational programs, which can include complex activities like Scrabble and chess, but can also include the most simple of activities like story times. Just this year, I had the opportunity to partner with DeRote and with the Next Generation Teen Council to plan, lead, and implement 4 intergenerational online and in-person events between November of 2022 and June of this year, 2023. Our Zoom events allow older adults to interact from the comfort of their own home, allowing us to reach older adults who want to be able to interact but may not be able to because of physical limitations. We also planned intergenerational in-person events, like having a brunch, which is shown below, and having a picnic in Central Park, which is shown above. These activities were very fun and allowed both seniors and teenagers to interact and socialize and have fun. Intergenerational interaction allows for a variety of benefits for teenagers and for senior citizens especially. For one, it allows for a reduction in age stereotyping. Because intergenerational interaction allows for teenagers and senior citizens to come face to face and to have direct contact with one another, it allows for a decrease in bias and for an increase in inclusivity. Teenagers are able to see things from the perspective of senior citizens, which thus helps to break down the stereotypes that come with old age. Perhaps one of the most obvious benefits of intergenerational interaction is a reduction in social isolation for both senior citizens and for teenagers. Simply by merit of meeting with each other and interacting, intergenerational interaction allows for a decrease in loneliness and for a decrease in isolation. Finally, intergenerational interaction has been linked with an improvement to well-being. Research shows that seniors and older adults who participate in intergenerational programs have heightened senses of self-esteem and of belonging. On the flip side, teenagers and older adults who participate in intergenerational programs have heightened social and emotional skills and are able to empathize at greater numbers. So to summarize, social isolation is an epidemic and older adults are affected at a disproportionately high rate. One way to combat social isolation is through intergenerational interaction, which is usually facilitated through intergenerational programs. If there's one thing that I want you to take away from this presentation, it's to not be afraid to interact with other people. The next time that you see an elderly adult, take the chance to say hi, to learn what they like. And if you're really feeling bold, join intergenerational programs near you. There are an abundance of intergenerational programs, both virtual and in person, that are looking for youth volunteers. Thank you for listening to my presentation. These are my references, and I would like to acknowledge DeRote for allowing me to make so many connections with teenagers and older adults. And to the audience, thank you for listening. You can find me at my email listed here, and thank you.